Hi everybody, this is Dr. Michael Baskey here at the Parker Walmart Vision Center, and one of the questions I get asked frequently is what are cataracts and what can I do about them? So we're going to discuss cataracts today, and cataracts are a clouding effect of the lens of the eye, which is right behind the iris, and the lens it creates a lot of the focusing ability in our eyes. And it's also responsible for 48% of the world's blindness, which equals about 12 million people in the world, according to the World Health Organization. So it affects a lot of people, and when it does affect you, there can be a slow dimming effect of their vision. They can start out really tiny, and where it's just a small little blurring effect. And then as they develop in the eye, they start to affect the contrast sensitivity, which is you start to lose the sharpness of things. Colors look a little dimmer. Shadows can also be increased, and driving at night can also be affected. Some people have told me they experiences a starburst effect as the light hits that cloudiness in the lens, and it creates a lot of problems driving at night. So you may feel that you're not comfortable driving at night, and it could be due to a little cataract. And so the one cause of cataracts is exposure to ultraviolet radiation. So the lifetime exposure to UV light, which seems to be increasing because of a decrease in the ozone layer, but that can be another discussion. And so things you can help to stop the UV exposure is wear sunglasses as much as you can, especially if you have to work outside or outside or play outside, like on a boat or fishing, and just doing a lot of outdoor activities. So with this cataract affecting your vision, you want to have that looked at on a yearly basis, and it usually starts in our 50s and 60s, but there are cases that can start as early as in your 30s. One of the causes of cataracts is due to a lot of steroid induced. So using steroids for like asthma, like inhalers, or nasal spray steroids, or just steroids injected in the body, or for other conditions that create inflammation, and the steroids are trying to get rid of the inflammation. Steroids can increase the chances of more cataracts. There's one little study done in Iceland, is that there was a higher percentage of pilots that were getting cataracts because of the exposure to the radiation from the sky and from the atmosphere. So as a pilot, you need to be well aware of that you may be getting cataracts at an earlier phase. So there's some research out there of taking antioxidants, supplementation like vitamin C and vitamin E, should be able to help control the changes in the protein binding and the denaturing effect in the lens, which is creating this clouding effect. So think of this cataracts as being the windshield. You have the windshield start to get a little pit in there from a rock, and then it just starts to grow, and then it can be cloudy, like the road grime on the cataract. And unfortunately, there's no windshield wipers to wash away that grime, and so this lens will start to crack and split and just becomes yellow. And when the yellowing occurs, your colors can be changed, and so they start to become less vivid. The whites and may start to become duller, and maybe even become a little bit yellowing because of that lens. It actually would create a filter effect on the eye, so your colors are less vivid. And so cataracts is the most or cataract surgery is the most performed surgery in the United States. It's done in approximately 80% in people between the ages of 75 and 100. That's the most surgical procedure done here in the United States. So we need to protect the eyes from the sun, take our vitamin C and our vitamin E, and that should help slow down the progression of the cataracts. One other study that's going on right now is the occurrence of hormone replacement therapy. That if you are on hormone replacement therapy and are a smoker and have an excess of alcohol use, you have a 56% chance that you are going to have cataracts at a younger age. So if you are on hormone replacement therapy, you should be consulting with your primary care doctor and or your eye doctor to have that checked out. So those are the things that are on the verge out there that are being researched on, being talked about to help so how medicine can actually affect the lens of the eye, and then it can create some cataracts. But cataract surgery is a very easy procedure. I don't say easy; it's a major surgery. So, but it's since it is the most surgical procedure done, there's a very good results done. Sometimes even close to where you can see 20/40 to 20/20 without your glasses on. So, it's a very recommended surgery. So I hope a lot of information is helpful for you. If you have any more questions, give us a call at the phone number 303-840-4440, and check us online at the website below, and we'll have more videos available for you. Again, if you have any more questions, give us a call, and you should have your eyes checked on a routine basis so we can look for changes in the eye, cataracts, and other things. So we'll see you on the other side. Thank you.